Hello, my name is Menniti and the topic my group has been allocated is bacterial pneumonia.
Bacterial pneumonia, an infection of the lungs that is caused by the bacterium that resides in the upper respiratory tract, a non-sterile environment that is continually exposed to the environmental pathogens. One of the common causes of bacterial pneumonia is the pathogenic Haemophilus influenzae. This causes damage to the respiratory epithelium and the mucociliary dysfunction, which leads to the loss of barrier function and invasion of bacteria. Invasion and spread of bacteria into the lung parenchyma at the alveolar level is what causes bacterial pneumonia. This pneumonia causes a dysregulation of the innate and adaptive immune responses, leading to the harmful cycle of increased virus production and further tissue damage. Bacterial pneumonia can be categorized into 4 groups based on how the pneumonia is actually acquired. These include community-acquired, hospital-acquired, healthcare-associated, and ventilator-associated. Haemophilus influenzae has been linked to the community-acquired pneumonia and is transferred by airborne droplets. Haemophilus influenzae is a gram-negative catalase-positive cocobacillus that is found in the upper and lower respiratory tracts. It is grown at 37 degrees Celsius with 5% carbon dioxide. Transmission to a new susceptible host occurs from the nasopharynx, and this serves as a potential reservoir of infection from the bacterium that may spread to the lower respiratory tract and is a major cause of pneumonia. Haemophilus influenzae causes a variety of local and systemic infections, which is spread by the airborne droplets and contact with secretions such as coughs and sneezes. Bacterial colonization in the upper airway is a prerequisite of all these infections. Infections of pneumonia caused by the Haemophilus influenzae are usually treated with oral antibiotics, such as cephalosporins, a beta-lactam that is derived from a fungi. These are considered an appropriate first-line therapy. Haemophilus influenzae is a vaccine-preventable illness, currently the most effective public health strategy for reducing bacterial pneumonia by immunizing against Haemophilus influenzae. It has been available since the 1980s. According to the World Health Organization, preventing pneumonia is essential to reducing mortality in children, and the immunization is the most effective way to prevent pneumonia. Other factors to consider is nutrition and environmental, as well as the indoor air pollution and good hygiene practices, especially in crowded homes.
Pneumonia is an infection of the lungs that can be caused by bacteria, viruses, or fungi. Pneumonia is commonly spread by inhaling infected droplets in the air from a cough or a sneeze of an infected person. It can also be spread via blood. There are many symptoms of pneumonia. Some of these can be a cough with thick yellow-green or blood-tinged mucus, stabbing chest pain that worsens when coughing or breathing, fever, sweating and shaking, chills, shortness of breath, loss of appetite, low energy and fatigue. The lungs are made up of small sacs called alveoli, which fill with air when a person breathes. When an individual has pneumonia, the alveoli becomes inflamed and filled up with pus and fluid, which makes breathing painful and limits oxygen intake. T cells play critical roles in the immune system. CD4+, known as the helper cell, and T cells help B cells to mount antibody responses. There are 3 main categories that are risk factors to being infected with pneumonia. These are 1. Medical conditions, such as chronic lung diseases known as COPD, bronchitis, or cystic fibrosis. Also, if someone has a weakened immune system, such as a recent viral respiratory infection, cold, laryngitis, or influenza. 2. Health behaviors. Cigarette smoking, which damages the lungs. Drug and alcohol abuse, which increases the risk of aspiration pneumonia. And 3. Environment. Exposure to certain chemical or toxin fumes, including secondhand smoke. Pneumonia accounts for more deaths than any other infectious disease worldwide. Anyone can get pneumonia, but many factors can increase your chance of getting sick and having a more severe illness. One of the most important factors is your age. People aged 65 and over are at increased risk because their immune system is becoming less able to fight off infection as years go by. Infants and children 2 years of age or younger are also at increased risk because their immune systems are not yet fully developed. Most cases can be treated successfully, although it can take weeks to fully recover.
Haemophilus influenzae does not always manifest a singular localized infection. It can cause multiple types of infection, those of which can be systemic or spread via the respiratory tract. However, bacterial pneumonia is a very common infection caused by the microorganism. Tests for bacterial pneumonia include blood samples, which check for high counts of neutrophils, which is an indicator of infection, nasopharyngeal swabs. This is taken to collect sputum and cultured in a laboratory to identify any organisms which might be cultured in this time. Urine. This is taken midstream and cultured in a laboratory to analyze any growth of bacteria. Related conditions include meningitis, a septicemic condition which can be detected through a blood sample, epiglottitis, an infection where the tissue protecting the trachea becomes inflamed and swollen. This can be discovered via nasal pharyngeal swabs. Acute and chronic respiratory tract infections, which are upper and lower respiratory tract infections that include bacterial pneumonia. These can also be detected by nasopharyngeal swabs. UTIs, although rare, are a result of a positive urine sample for Haemophilus influenzae. Treatments for bacterial pneumonia include medication, which can be antibiotics and penicillin, supportive care, which can be oxygen therapy, oral rehydration therapy, or intravenous fluids. To resolve the infection, antibiotics stop the growth of or kill bacteria where penicillin kills specific bacteria. The antibiotics found to be most effective against bacterial pneumonia is macrolides. These work by inhibiting protein synthesis in the microorganism and thus rendering it inefficiently pathogenic. Amoxicillin is also among one of the most effective antibiotics for bacterial pneumonia as it works by inhibiting the microorganism to synthesize cell walls, again rendering them as an ineffective pathogen. Oxygen therapy provides extra oxygen to the lungs of people with breathing problems and is given when oxygen saturation in the blood is below 92%. Oral rehydration therapy is giving fluids by the mouth to treat dehydration caused by diarrhea. IV fluids deliver fluids directly into a patient's veins where absorption is at 100%, thus generating rehydration in the patient.